Welcome to our Global Health and Awareness channel.
We invite everyone watching our videos to subscribe and hit like so we can bring you the very best. More explanations about health topics, diseases and their symptoms, modern treatments, medical insights, and the latest discoveries in medicine.
Our videos are available in both
Stay
Arabic
with us
and
as we
English.
dive deeper
Join
into
us.
understanding this condition.
In this video, you'll find the
Overview.
latest medical insights
Absent
and
seizures
information.
involve brief, sudden lapses of consciousness. They're more common in children than in adults. A person having an absent seizure may stare blankly into space for a few seconds. Then the person typically returns quickly to being alert. This type of seizure usually doesn't lead to physical injury, but injury can happen if someone is driving a car or riding a bike when the seizure happens. Absent seizures usually can be managed with anti-seizure medicines. Some children who have them also develop other seizures, such as generalized tonic-clonic seizures or myoclonic seizures. Many children
Stay with
outgrow
us as
absent
we watch
seizures
this
in their
video to
teens.
understand the symptoms of this disease.
The symptoms of this disease are
Symptoms.
explained in
A
this
simple
video.
absent seizure causes a vacant stare, which may be mistaken for a brief lapse in attention. The seizure lasts about 10 seconds, though it may last as long as 30 seconds. There's no confusion, headache, or drowsiness after the seizure. Symptoms of absent seizures include a sudden stop in activity without falling, lip smacking, eyelid flutters, chewing motions, finger rubbing, small movements of both hands. Afterward, there's usually no memory of the incident. But if the seizure is longer, the person may be aware of missed time. Some people have many episodes daily. When it happens, it can interfere with school or daily activities. A child may have absent seizures for some time before an adult notices them. This is because the seizures are so brief. A decline in a child's learning ability may be the first sign of the seizure disorder. Teachers may say the child has trouble paying attention or that
Stay
a
with us
child
as
is
we watch
often
this video
daydreaming.
to understand when you should see a doctor.
If these symptoms appear,
When to see a
don't
doctor,
hesitate
contact
to see
your
a doctor.
child's pediatrician if you're concerned that your child may be having seizures. If your child has epilepsy but develops symptoms of a new type of seizure. If the seizures continue to occur despite taking anti-seizure medicine. Contact 911 or emergency services in your area if you observe prolonged automatic behaviors lasting minutes to hours.
Stay with us as we watch this video to understand the causes of this disease.
Causes
Avoid
absence
these
seizures
causes.
usually have a genetic cause. In general, seizures occur as a result of a burst of electrical impulses from nerve cells in the brain, called neurons. Neurons typically send electrical and chemical signals across the synapses that connect them. In people who have seizures, the brain's usual electrical activity is altered. During an absent seizure, these electrical signals repeat themselves over and over in a 3-second pattern. People who have seizures also may have altered levels of the chemical messengers that help the nerve cells communicate with one another. These chemical messengers
Stay
are
with
called
us as we watch this video
neurotransmitters.
to understand the risk factors
Well,
for this
risk.
disease.
Avoid
Risk
the
factors. Certain
for this
factors are
disease.
common to children who have absent seizures, including age. Absent seizures are more common in children between the ages of 4 and 14. Sex. Absent seizures are more common in females. Family members who have seizures. Nearly a quarter of children with absent seizures
Stay
have a
with us
close
as we watch
relative
this
who has
video to
seizures.
understand the complications of this disease.
The complications of this disease are explained in
Complications.
detail in this video.
While most children outgrow absent seizures, some must take anti-seizure medicines throughout life, eventually have full convulsions, such as generalized tonic-clonic seizures. Other complications can include trouble with learning, trouble with behavior, social isolation,
Stay with us as we
injury
watch this
during the
video to
seizure.
understand the diagnosis of this disease.
This disease is diagnosed using the
Diagnosis.
latest medical technology.
Your child's healthcare professional asks for a detailed description of the seizures and does a physical exam. Tests may include electroencephalography, EEG. This painless procedure measures waves of electrical activity in the brain. Brain waves are transmitted to the EEG machine via small metal plates called electrodes that are attached to the scalp with paste or an elastic cap. Rapid breathing, known as hyperventilation, during an EEG study can trigger an absence seizure. During a seizure, the pattern on the EEG differs from the typical pattern. Brain scans. Brain imaging methods, such as MRI, can help rule out other conditions, such as a stroke or a brain tumor. Brain scans produce detailed images of the brain. Because your child needs to hold still for long periods, talk with your healthcare professional about the possible use of sedation.
Understand the treatment for this disease.
This disease is treated using the latest technology
Your
and medical
child's
discoveries.
healthcare professional may start at the lowest dose of anti-seizure medicine possible. Then, the dose may be increased as needed to manage the seizures. Children may be able to taper off anti-seizure medicines under the supervision of a healthcare professional after they've been seizure-free for 2 years. Medicines prescribed for absent seizure include ethos, oxamide, Zerontin. This often is the first medicine prescribed for absence seizures. Most people see improvement in their seizures with this medicine. Possible side effects include nausea, vomiting, sleepiness, sleep disturbances, and hyperactivity. Valproic acid. Valproic acid treats children who have both absence and tonic-clonic seizures, also known as grand mal seizures. Side effects of valproic acid include nausea, attention problems, increased appetite, and weight gain. Rarely, the medicine can cause inflammation of the pancreas and liver failure. Females who continue to need medicine into adulthood need to talk about the potential risks of valproic acid with their healthcare professionals. Valproic acid has been linked to a higher risk of birth defects in babies. Healthcare professionals typically advise not using it during pregnancy or while trying to conceive. Lamotrigine, Lamictal. Some studies show this medicine to be less effective than ethosuximide or valproic acid, but it has fewer side effects. Side effects may include rash and
the
nausea.
Lifestyle and home remedies for this disease.
Lifestyle and home remedies.
Questions.
Dietary therapy. A ketogenic diet can improve seizure control. This diet is high in fat and low in carbohydrates. It's used only if traditional medicines don't manage seizures. This diet isn't easy to maintain, but it's successful at reducing seizures for some people. Variations on a ketogenic diet also might provide benefit. These diets include the glycemic index and modified Atkins diets. Although these diets are less effective at managing seizures, they aren't as restrictive as the ketogenic diet. Additional options. Here are other steps that may help manage seizures. Have your child take medicine as prescribed. Don't adjust the dose before talking to your child's healthcare professional. If you feel that your child's medicine should be changed, talk with your child's healthcare professional. Encourage enough sleep. Lack of sleep can trigger seizures. Be sure that your child gets enough rest every night. Have your child wear a medical alert bracelet. This will help emergency personnel know how to treat your child correctly if another seizure occurs. Ask your child's healthcare professional about driving or other restrictions. Someone who has regular seizures needs to be free of seizures for a certain amount of time before being able to drive. The amount of time required since the last seizure varies from state to state. Also, don't bathe or swim unless someone else is nearby to help if needed.
Video to understand alternative treatments.
You should consult a doctor
Coping
about
and
alternative
support.
treatments.
If you or your child is living with a seizure disorder, you may feel anxious or stressed about the future. Stress can affect your mental health, so it's important to talk with a healthcare professional. Seek resources for help. At home, your family members can provide much-needed support. Tell them what you know about your child's seizures. Let them know that they can ask you questions and be open to conversations about their worries. Help them understand the condition by sharing any educational materials or other resources that your healthcare professional has given you. At school, talk with your child's teachers and coaches about your child's seizure disorder. Explain how it affects your child at school. Discuss what your child might need if a seizure happens at school. You're not alone. Remember, you don't have to go it alone. Reach out to family and friends. Ask your healthcare professional about local support groups or join an online support community. Don't be afraid to ask for help. Having a strong support system is important to living with
Find out
any
in this
medical
video
condition.
how to prepare for your appointment.
Don't
Preparing
hesitate
for your
to ask your
appointment.
doctor questions.
You're likely to start by seeing your child's healthcare professional. However, you'll probably be referred to a doctor who specializes in nervous system disorders, known as a neurologist. Here's some information to help you get ready for the appointment. What you can do. Write down any symptoms you notice, including any that may seem unrelated to seizures. Make a list of all medicines, vitamins, and supplements you or your child takes, including the doses. Write down questions to ask. Preparing a list of questions can help you make the most of your time during the appointment. For absent seizure, some basic questions to ask include, what's the most likely cause of these symptoms? What tests are needed? Do these tests require special preparation? Is this condition temporary or long-lasting? What treatments are available and which do you recommend? What are the side effects of the treatment? Is there a generic alternative to the medicine you're prescribing? Can my child also develop the grand mal type of seizure? Are activity restrictions necessary? Are physical activities such as soccer, football, and swimming okay? Do you have brochures or other printed material I can take? What websites do you recommend? Don't
Find out
hesitate
in
to
this
ask
video
any other
what to
questions
expect
you
from your
have.
doctor.
Don't hesitate to ask your doctor any questions.
What to expect from your doctor. Your child's healthcare professional is likely to ask you a number of questions, such as, when did the symptoms begin? How often have the symptoms occurred? Can you describe a typical seizure? How long do the seizures last? After the seizure, is
Thank you
there
for your
awareness
trust in
of
us
what
and our
happened?
channel.
Subscribe to the channel and activate the bell to stay up to date.